My name is Sam Bauman. I am a community health worker at Jordan Valley Community Health Center, and I've been a community health worker since September of 2015. As a community health worker, we're able to provide a link between the Missouri HealthNet participants and the healthcare system. Most people, their health is not their priority. It's something else. It's their family, it's their finances, it's their stress level, their work. There's so many other factors in life. And I think community health workers really help bring that together because we're looking at the person as a whole. I always tell patients, I'm not a medical member of your treatment team. I'm here for the other things that affect your health.
When we started the community health worker pilot in July of 2015, we focused on Springfield, Branson, and Joplin and the outlying areas that have populations that seek care in the different primary care practices. What we anticipated was that these community health workers would help advance our primary care health home mission and would facilitate the linkage that we were trying to build between the healthcare system and those community-based resources.
They build relationships with our patients, and they help to connect the patient to the clinic resources as well as resources outside the clinic, including things such as housing needs and transportation and food assistance.
They really assist in getting the patients navigated through our system. There are a lot of different steps that patients can take, and they're just providing that additional layer and being that additional resource to those patients.
They each have a panel of people that are assigned to them. Our community health workers do a lot of traveling to see the panel of folks that they take care of.
This is Michelle.
My name is Michelle Sapples, and I live in Southwest Missouri, and I've been a community health worker since 2016. I work with around 50 to 75 participants who need extra support with their healthcare needs. My participant, Tom, he was brought to my attention by one of our primary care doctors.
I'm a diabetic, first of all. And then I had a stroke a number of years ago, so I have particularly difficult high blood pressure. It's hard to manage. I didn't have any support system in place. I had no medical coverage, and I had some serious medical issues.
When I reached out to him, I found out he needed assistance with Social Security office, HealthNet, food stamps. Everything was turned off.
Michelle appeared out of nowhere. Someone must have called her and said, you might want to talk to this guy. And she said, you know, that part of my role is to assist you in getting these needs met. The next day, she showed up, I think it was the very next day, and she said, we're just going to go sit at the Social Security office because that's what we have to do.
It was a long process, but now he has his disability, he has his HealthNet, he has his food stamps. He is making his own appointments now for transportation, and he's more self-sufficient.
I think that's probably her greatest gift, is her ability to pull all of these things together, or to make you aware of them so that you can pull them together yourself. And had I not always had someone to call, no matter what the situation was, whether it was within the parameters of her job description or not, she could tell me who I had to talk to.
One of the benefits of a community health worker through our experience is the familiarity that they do have with the community and the relationship that they develop with the panel of individuals that they care for. So someone who is working with a community health worker has an individual that they can call and talk to anytime.
My name is Becky Sleaze. I work here at FMCC with 75 participants with the HealthNet.
Family Medical Care Center, this is Becky. How may I help you?
I know if they're having problems with food, if they're having problems with glasses or getting incontinence supplies, that those are things that we can step in and help. You know, I make appointments, meet them at one door, which is a housing, or get them rides. You know, they may call and say, I'm sick, I'm really, really sick. We'll send a cab for them. I always tell our participants, just ask.
I had a patient once that I worked with that I had reached out to him. He was in the hospital, and I went to check in on him, and he actually hadn't been in to see us in a few months, and found out that Basically, he had requested a refill on a prescription, and when he didn't get that refill, he thought that we had denied him. So to him, he felt like we were not providing that care to him. In reality, it was just a communication error, and I was able to get him in here to see a provider and get him back on that medication, but he had been using the hospital to get that medication for months.
We're trying to get the patients here to the clinic as opposed to going to the ER so that they get the preventative care that they need prior to having to need to go to the ER. So that has improved their outcomes and also improved cost.
Within Cox Health, we have seen a significant reduction in our ED utilization with our participants within the collaboration. The community health workers are really able to provide one-on-one education to these patients to let them know that there are different avenues that they can use instead of going to the emergency departments.
Just by showing them how to reach out to these resources, you're giving them tools that's going to last them the rest of their life.
One of the benefits that we've seen from the Primary Care Health Home Community Health Worker Pilot in Southwest Missouri, there have been some opportunities to network and to really build those relationships and to sort of be on the same page.
We meet with other community health workers in the region at Community Partnership at the Ozark once a month, and that has been a really great asset for us. Especially in the beginning, when we started this program, we kind of had a goal and we had a definition of what a community health worker was, but not necessarily what that looks like day to day, how that community health worker was going to fit into the healthcare system, and it's different for every healthcare system. So it was really helpful to talk to other people about their experiences, how they were trying to integrate into the team, their successes, their challenges, and just to bounce ideas off of each other.
We've become close. We rely on each other. We call each other for questions. Someone's already worked through a resource problem. You can call them and they've got the answers. Or you might have, answers for them. When we have our meetings at CPO, especially, they'll have people come and talk from different resources. And so it's a learning process too. This whole thing's been a learning process of what is out there, what are the needs.
Now that we are all pretty established within our clinics, now we can discuss more community needs. Well, we can say, hey, I've got 10 patients that have this need, and if Becky has 20 patients that have this need, we can look at, hey, we've got 30 patients just between the two of us that we know that have this need. That means there's probably dozens more in the community. So is that something that a community member or organization could potentially look at meeting that need?
So HealthNet has been working with several partners to develop the pilot. That included the Missouri Foundation for Health, as well as the Healthcare Foundation of Greater Kansas City, and the Department of Health and Senior Services, and MoFac. The Community Health Worker Pilot and the Primary Care Health Home Program has been a great experience for our providers and for HealthNet. We're grateful to both foundations for their support in providing assistance to put the pilots in place, and also grateful to both sister agencies for their participation in developing some of the details of the pilot.
The community health workers have become a part of our team. It's new and it's innovative, and it's something that is exciting to become a part of our healthcare system. We are excited to be able to offer this resource to our patients, and we're already seeing significant improvements in these patients' lives.